Number 3, Tomas and Bob respond to a convenience store where a disoriented person was found sitting on the sidewalk. There's a paper bag with gold spray paint next to it, next to the patient. And the patient has gold spray paint around their mouth and nose. The patient seems confused as Tomas and Bob approach. So what are the clues at this scene to tell you what the problem is and what you should anticipate?
What do you think they did?
Huffers. Yes. What treatment should you anticipate this patient may need? Right. You're absolutely right. Alright, so drug and alcohol emergencies. Significant medical problems are associated with drug withdrawal and overdose. Okay, we talked about DTs yesterday. You can actually die from DTs. Alright. Some of the problems you'll see is an altered mental status, respiratory depression. Patients abusing drugs or alcohol can be unpredictable and violent. Drug abuse is defined as the self-administration of drugs or of a single drug in a manner that is not in accord with approved medical or social patterns. A drug or alcohol overdose is an emergency that involves poisoning by drugs or alcohol. A patient's withdrawal from drugs and alcohol, which is a period of abstinence from whatever they're using, all right, to which the body has become accustomed to, can be as serious as an overdose. Okay? Several medical problems can result from any drug overdose or from sudden withdrawal from a drug. Among the most common are altered mental status, respiratory depression, damage to organs such as the kidneys or liver, seizures, cardiac arrest, hyper or hypothermia. The range of medical problems you can confront in a drug abuse patient is extremely wide and depends on the type of drugs they have taken. For example, stimulants such as cocaine increase heart rate and blood pressure, whereas depressants such as barbiturates lower them. Alright, some of the things you're going to see. Stimulants, which is amphetamine, caffeine, cocaine, ephedrine, nicotine, over-the-counter and prescription drugs, and methamphetamines. Alright, stimulants, they're uppers. They increase your heart rate, increase your respiratory rate, increase your blood pressure. You have loss of appetite, insomnia. They can become paranoid, have hallucinations. They can become violent as well. Okay? Cannabis, which is hash, marijuana, or THC. These people have what's called cotton mouth or dry mouth, euphoria. Cannabis or marijuana is actually being used in the medical field, medical marijuana now for like cancer patients and stuff. Okay, it helps with their nausea, increases their appetite. Narcotics or opiates. Alright, this is going to be your codeine, heroin, methadone, morphine, fentanyl, oxycodone, hydrocodone, hydromorphone, opium. Alright, these are going to be your downers. Okay, it's going to produce drowsiness, respiratory depression, low blood pressure, pinpoint pupils. Depressants also include alcohol, antihistamines, barbiturates, other non-barbiturate and non-benzodiazepine sedatives, diazepam, other kinds of benzos, and tranquilizers. Okay. They'll have a slurred speech, drowsiness, incoordination, kind of like they're drunk, respiratory depression. Hallucinogens. Only one on here I recognize is LSD, MDA, and PCP. Get motor disturbances, anxiety, poor perception of time. They have very, what is it called when they have like this abnormal strength? It's like they turn into He-Man with the PCP.
Superman syndrome?
Yeah, Superman syndrome, that's what I'm trying to say. No, they will beat you to a freaking pulp. You can tase them.
You can shoot them about 6 times,
Shoot them.
they won't feel it.
They do not feel anything. Nothing. That's why a lot of the cops and stuff, when they tase these people, like, they don't go down, and they'll keep tasing them, which is what leads to the cardiac disturbances and stuff because they keep tasing them. I keep tasing them too, but it's just all right, inhalants. This is going to be aerosol propellants, gasoline, kerosene, glues, lacquer, lighter fluid, typing correction fluid, my favorite, medical anesthetics, and propane. This produces euphoria, giddiness, loss of inhibitions, also aggressiveness and hallucinations and erratic behavior. Habitual alcohol abusers or alcoholics are prone to a wide variety of illnesses ranging from cirrhosis of the liver to peritonitis. In addition to causing medical problems, alcohol intoxication is a major cause of automobile crashes. Alcohol ingestion, even in smaller doses, is also a major factor in drug overdoses, homicide, burns, drownings, trauma, and other things. Alright, scene size up. Scenes can involve drugs or alcohol, involve violence usually, and they are very unpredictable. You need to have law enforcement there for backup. Note anything unusual that could be used as a weapon. Use your standard precautions. For general impression, consider the need for C-spine stabilization. Assess for any immediate life threats. Altered mental status. Pay particular attention to their airway. CNS depressants can cause inadequate breathing. You need to support that. Heart rate and blood pressure can be affected, which may decrease their perfusion. It can be high or it can be extremely low. Always consider the possibility of underlying trauma and medical conditions. Do your rapid secondary assessment, physical exam history, and always get a good baseline set of vital signs. Okay? These signs and symptoms make the patient a high priority, just like we've talked about throughout this chapter. Unresponsive or having seizures, inadequate breathing, abnormal heart rate, or vomiting with an altered mental status, just because you can't protect the airway. The signs and symptoms can vary widely depending on the substance or drug that was actually abused. Often the patient abuses more than one substance or drug. For example, a patient can take a CNS stimulant, drink large amounts of alcohol, and then take a CNS depressant. This would produce a variety of conflicting signs and symptoms. Alright? They could be anywhere from bradycardic. With that comes hypotension, decreased breathing rates, dilated pupils, bradycardia, lethargic, constricted pupils. Alright, this is signs of track marks. If you've seen me in the last 2 weeks, I look like a drug addict because I've let the paramedic students stick me about 1 million fucking times. But this is what they look like. Look for these, okay? Hallucinogens produce dilated pupils, paranoia, anxiety, poor perception of time and distance, auditory and visual hallucinations. Excitement, euphoria. This is a volatile inhalants. These all pretty much produce the same things, okay? Scene safety is your priority. Your safety and the scene safety. Closely monitor the patient, and changes can occur very rapidly. Alright? Don't ever turn your back to one of these patients. Calm the patient and protect them from hurting themselves. More importantly, protect you from them hurting you. Alright? Emergency care provided to drug, substance, and alcohol abuse patients is mostly supported. Scene safety is your priority. Close monitoring of the patient is necessary because of rapid changes in their condition. Alright? Always, always, always BSI, scene safe. Alright? Establish and maintain an airway, maintain their oxygenation, and position the patient. They will puke. Alright? Maintain their body temperature, assess their glucose level. Alright? What is a drug addict? Are they more prone to, if they get some money, are they going to buy more drugs or are they going to buy food? They're going to buy more drugs. An alcoholic, are they going to buy food or are they going to buy more alcohol? They're going to buy more alcohol, okay? But another thing is sometimes when your glucose drops, you can have all these other things going on, okay? So we need to kind of rule that out. Alright, restrain the patient only when necessary and when you have enough people to safely do that. Alright, and reassess frequently. Alright, drug and alcohol abuse can lead to unpredictable and violent behavior. I cannot say that enough, okay? Always, always, always know your exit, okay? And I'm gonna be real honest with you. I don't really give a fuck about a bystander. If they wanna be all up in somebody's business while that's going on, that's on them. But however, Caleb finna get the fuck up out of there, okay? Exactly. So, just keep that in mind. Alright, the talk down technique. I've never actually had this work, but however, I will teach it. Make your patient feel welcome. Identify yourself. Do not invade their personal space. Reassure them that their condition is caused by drugs and is temporary. Help the patient verbalize what's happening to them. Reiterate simple, concrete statements. Forewarn the patient what will happen once the drugs begin to wear off, and once the patient is calm, you can transport them. Don't judge. Alright, withdrawal. Tolerance. Everybody know what tolerance is?
Yep.
Okay. You have to have larger amounts to produce the same effect. And dependence means you are dependent on that drug. You have to have it to be able to function. There's also called psychological dependency. Alright? They think that they have to have that drug to function. Then you have the physical dependency, where they actually show physical signs of withdrawal. It's not just a mental thing anymore, it's actual physical signs. They'll start shaking, acting crazy, scratching, yes. Alright, drugs that produce physical dependency are narcotics, sedatives, hypnotics, barbiturates, cocaine, and marijuana. I don't know that I quite agree with that, but whatever. It's important to recognize drug withdrawal as a condition that can cause seizures or a deterioration in the patient's mental status and can result in a blocked airway, inadequate breathing, or poor circulation. Some common findings of withdrawal include anxiety, agitation, tremors, profuse sweating, hallucinations, elevated heart rate and blood pressure, tactile hallucinations. They feel things crawling on them, touching them, stuff like that. Or the spiders, yes. You can left that alone. And seizures. Okay. The alcoholic syndrome usually consists of a problem drinking, during which alcohol is used frequently to relieve tension or other emotional difficulties. And a true addiction, in some which abstinence from drinking causes physical withdrawal symptoms. Okay. You know, a lot of people in EMS that when they have a bad call, they have a rough shift, first thing they do, go get some beer, some whiskey, whatever. Try not to get into that pattern, okay? Alright, the alcoholic usually begins drinking early in the day, is more prone to drink alone or secretly, and can periodically go on prolonged binges, characterized by loss of memory, also known as blackouts. Not to be confused with syncope. For those that were outside during our session. Yeah, me too. Abstinence from alcohol is likely to produce withdrawal symptoms such as tremors, DTs, seizures. Alright, alcoholics are prone to hypertension, altered mental status due to liver malfunction. Okay, your liver builds up these toxins and it can actually render you or make your level of consciousness deteriorate. Cirrhosis of the liver can have liver failure, pancreatitis, GI bleeds, bone marrow suppression, subdural hematomas, seizures, fractures from falling, upper GI bleeding, lower GI bleeding. One of the most serious disorders associated with alcoholism is Wernicke-Korsakoff syndrome, a chronic brain syndrome resulting from the toxic effects of alcohol on the central nervous system, combined with malnutrition, is common among alcoholics. Common signs and symptoms of the syndrome include paralysis of the eyes, dementia, hypothermia, the inability to sort fiction from reality, and comas. Withdrawal syndrome occurs after a period of abstinence from a drug or alcohol to which a person's body has become accustomed. However, it does not require that the alcoholic or drug abuser stop drinking or taking the drug completely. The withdrawal syndrome can also occur when an alcoholic's intake falls below the amount usually ingested. Alcohol withdrawal is dose dependent. The more alcohol was consumed, the more severe the syndrome will be. Alright, you have 4 stages. Stage 1 occurs within 8 hours after their last drink. They will have nausea, insomnia, tremors, and sweating. Stage 2, 8 to 72 hours. They have worsening of stage 1 combined with hallucinations. Stage 3 happens as early as 48 hours. This is where your seizures start. And stage 4 can occur anywhere from 1 day to 14 days after the patient's last drink, and this is where your DTs start. Okay? The last stage of alcohol withdrawal, DTs, delirium tremens, is a severe life-threatening condition with a mortality rate of approximately 5 to 15%. It can occur between 1 and 14 days after the patient's last drink, most commonly within 2 to 5 days. A single episode of DTs lasts between 1 and 3 days. Multiple episodes can last as long as a month. DTs should be suspected in any patient with delirium of an unknown cause. Alright, seizures are common in alcoholic withdrawal, but not in DTs. However, approximately a third of those who have seizures in early withdrawal progress to DTs if left untreated, or if treated inadequately. The treatment goals for a patient who experiences DTs include psychological as well as physical support. An opioid is any natural, synthetic, or semi-synthetic agent that mimics the effects of morphine. Opiate is a term specific to natural agents derived from opium. Narcotic is a much broader term that specifically refers to agents that induce sleep. Therefore, it does not truly describe an opioid or an opiate. Although these terms are commonly used interchangeably, they do have different meanings. An opioid specifically refers to agents that act on opiate receptors in the body, such as heroin, which is a naturally occurring agent. Alright, stress is the most common physical finding of an opioid overdose. They have central nervous system, respiratory depression, constricted pupils, seizures, crackles in the lungs, hypotension, bradycardia, bradycypnia. Patients who abuse and overdose on opioid drugs and narcotics, such as heroin, have a depressed central nervous system. They often present with respiratory depression, hypotension, bradycardia. Focus your emergency care on reversing these effects, not to completely reverse the altered mental status. Okay, we just want to get their breathing, their heart rate, and their blood pressure up. Please do not slam them with 4 milligrams of Narcan. They will be highly pissed off. They will exorcist puke on you everywhere. And if you don't know what the exorcist puke is, you need to Google it. Okay? No, not playing a video of it. No. Okay? Their head will literally rotate 360 degrees and puke will go everywhere. And then they're going to be real big mad because you took their highway. Okay? So, we just want to give them enough to get their blood pressure up, their heart rate up, and their respiratory rate up. Okay? We don't want to completely take all that away. They're high, okay? Because, I don't know if y'all have ever fought somebody all the way to the emergency room, but I have, and it's not fun.
And you let the hospital take care of it.
Exactly. You do just enough.
So what if they like start fighting? Can you fight that?
Well, I mean, when it's you and that person in the back of the truck, you ain't got no choice but to fight back.
Can I was told that you can do a saline bag at them and it won't leave any marks.
Half-empty saline bag will not leave marks. However, at that point in time, I really don't give a shit about leaving marks. I will leave fucking marks. Because I'm telling you, if somebody reaches up and punches you or grabs you, it is human nature to defend yourself. I've hit a patient. I didn't mean to, but like it happened. They reached up, they grabbed me, and I fucking clocked them. It happens. Like that's just instinct. You know what I mean?
Yep.
So, anyways, moving on. Narcan is the generic name. The trade name is Narcan. Alright? We give this for patients with suspected or known opioid intoxication who have central nervous system depression, with respiratory depression, hypotension, and bradycardia. Alright, so our Narcan comes in a vial. I have some. Where'd they go? I had some.
Somebody stole it.
No. Who did I show that to earlier in my office? Anywho, it's this little thing. It comes pre-drawn up. You just squirt it up each nose.
Oh, you
It's
showed
not
me.
fun. But if you have to draw it up, this is the way it works. Draw up 2 milligrams. Put this thing right here on there. That's what goes up in the nostril. It's called a mucosal atomizer device, or a MAD device. And yeah, well, yeah, kind of, sort of. Usually they come up spitting, spurting, coughing, gagging, the whole 9 yards. Anywho, you put it up their nose, you squirt some in, you squirt some on the other side, and it's supposed to, yeah. Narcan is a pure opioid antagonist with a rapid onset of action. It binds competitively, or it competitively binds with the opioid receptors in the brain. It will actually knock that drug off of that receptor. It'll take their high away and bind to it so it can't come back and bind. Okay? It can reverse all of the receptor actions of the opioid by effectively blocking the ability of the drug to bind with that receptor site. Sometimes you have to give several doses of this. The emergency consequences of commonly abused drugs have unique effects. Others that are often abused include PCP, cocaine, amphetamines, and methamphetamines, and the drugs known as bath salts and ecstasy. Use requires special consideration in emergency care. There for a while, Mojo was a big thing in East Carroll. Mojo was a big thing in Faraday when I worked there too. And y'all, I don't understand how something synthetic can make somebody so freaking crazy. Well, that's true.
You can tell when they get a bad batch.
Woo,
Because it's
Lord.
like all of them.
Yes.
Bath salts make you eat your woman's face off.
Yeah.
Well, okay. One of the most dangerous hallucinogens is PCP. Known by at least 46 names, it is also called angel dust, killer weed, supergrass, crystal cyclone, hog, elephant tranquilizer. If something can tranquilize an elephant, I'm pretty sure I don't need any of it. Peace pill, embalming fluid, horse tranquilizer, mint weed, mist, monkey dust. Pretty sure I'm not gonna. I don't even know. Do you snort it, smoke it? What do you do with PCP?
I ain't got
Huh? You smoke it? Okay. Pretty sure I would not smoke anything called monkey dust. I could be wrong. Anywho,
So you will smoke it?
well, like it'd have to be a really, really bad day. You know what I mean? Where just the alcohol and the cigarettes just ain't cutting it.
Just need the extra little
Exactly.
boost.
Yeah. No, I'm just kidding. Anywho, PCP is actually stored in body fat, so Chad, you don't have to worry about this, and can be released over time. Well, I'm screwed. Cocaine is inhaled through the nose, injected into veins, and injected into the muscle. Never known anybody to inject it into the muscle. It's always been snorted or, shot up. Anyway, an almost pure form of cocaine known as crack is smoked. Another special form of cocaine is heated and inhaled. This is called freebasing. Cocaine is highly addictive, and an overdose can actually be fatal. What? I'm gonna need you to share that. Share.
The YouTube video of freebasing cocaine.
In church?
Yeah, I've never freebased cocaine in church. Unless that's sermon I've heard before.
That's good. I'm gonna have to look that up. Amphetamines and methamphetamines stimulate the central nervous system. It excites the cardiovascular system and can produce hallucinations, hyperthermia, muscle rigidity, or severe excitation can occur, leading to long periods of awake, excited state. The resulting hypertension, hyperthermia, and increased muscle tone can be life-threatening. Methamphetamine use is associated with the sensation of ants or bugs crawling under the skin. The patient often picks at their skin or mutilates themselves. Panic attacks and visual or auditory hallucinations can also occur. EMS is seeing an increase in the frequent use of the illegal drugs, bath salts. These bath salts have no ingredients related to hygiene. However, they are synthetic designer drugs with properties that inhibit the reuptake of norepinephrine and dopamine in the body, usually the brain. As a result, the drug acts as a central nervous system stimulant. The effect of the drug is similar to methamphetamines and cocaine and produces similar signs and symptoms. A long-term user can build up a tolerance, and the cessation of use can trigger withdrawal and intense cravings. A patient who is taking bath salts can experience extreme sympathetic stimulation and an altered mental status. MDMA, most commonly known as ecstasy, is a recreationally used psychoactive stimulant drug that produces a feeling of empathy, euphoria, and heightened sensation. I use these at raves a lot. Also goes by the street name EXXTC, Smarties, Scooby Snacks, and Skittles. Now see, this is where I would be. I would be at the Scooby Snacks and the Skittles. Like, now that I'm down with. Monkey dust on another, no.
I like Smarties too.
I'm not down.
You know what the specific classification of that is for a drug that causes empathy? They call it an entactogen.
Okay. A what?
An entactogen. So MDMA and then MDA
Uh-huh.
are entactogens. They cause empathy. And
Entactogens.
extreme empathy.
Extreme empathy.
You get all lovey-dovey with them.
The drug has no medical purpose. Yeah, that's why they give it at raves and stuff, so they can have MDMA is usually taken by mouth. However, it can also be snorted and smoked. When ingested, its actions begin after approximately 30 to 45 minutes and can last from 3 to 6 hours. It is a commonly used drug in the rave culture. An overdose of MDMA can cause intracranial hemorrhage, severe hypertension, hypotension, seizures, hallucinations, respiratory distress syndrome or ARDS, cerebral edema, and hyperpyrexia, which is a life-threatening elevation of the core body temperature. Physical signs and symptoms of PCP, cocaine, amphetamines, methamphetamines, and or bath salts are pretty much similar. However, you should remember that emergency management is supportive and not geared towards figuring out what exactly they took. We just need to take them somewhere. Treated amphetamine, methamphetamine, cocaine, PCP, bath salts, or MDMA overdose as you would any other drug emergency. Check weekly to determine whether there are any injuries that need attention. If there are, administer emergency care as you would for any other trauma patient, ensuring that the airway is open and maintained, providing oxygen and ventilation, and support the circulatory system. Before continuing with psychological care, monitor vital signs regularly and transport the patient as quickly as possible, because you don't want them flipping out in the back of your truck. I'm just going to tell you, been there, done that, not fun at all. All right, THC is a natural form, is the principal psychoactive substance found in cannabis. Cannabis, also known as the marijuana, is a plant that is used for its psychoactive properties, such as recreational drug or a medication. Common slang term are weed, bud, doobie, Mary Jane, pot, blunt, herb, hemp, grass.
Ganja.
Ganja, yep.
Yeah.
Cannabis can be smoked, vaporized, eaten in food, usually brownies, or used as an extract. It is used as a recreational drug for the mental and physical effects to get high or stoned. It is currently legalized in 8 U.S. states. The user feels a general change in conscious perception, euphoria, an increase in the awareness of sensation, disorientation and perception of time or place, and an increase in appetite. A synthetic cannabinoid, often categorized as a new psychoactive substance, NPS, is a manufactured chemical that has similar effects to THC found in cannabis. It is an unregulated substance that is sold as a mind-altering chemical. Common names are K2, Spice, Joker, Black, Mamba, Kush, Bombay, Blue, Genie, and Chronic. Synthetics can affect the brain more powerfully than marijuana and can produce unpredictable and life-threatening effects. These people on this stuff are crazy too, okay? I'd much rather have somebody just chill on some weed than this crazy synthetic stuff, alright? Cannabinoid hyperemesis syndrome is experienced by chronic cannabis users who report recurrent nausea, vomiting, and abdominal pain and cramping. A hot shower or bath can reduce the symptoms temporarily. Cessation of the use of cannabis will fully eliminate the symptoms. Acute episodes of the syndrome typically last from 24 to 48 hours. However, it can take months to resolve completely after stopping cannabis use. This is the only time I have ever seen anything negative about marijuana use. It's like, you could actually, like, have something wrong with you.
I've never even heard of it.
Yeah, well, I'd never heard of it until I started using this class either. Theories on the cause of cannabis hyperemesis syndrome include a dose-dependent buildup of cannabinoid and related toxicity and the effect of the cannabinoid on the receptor in the brain. Primarily the hypothalamus, which regulates a body core temperature and the digestive system. And I wonder if that maybe is some kind of like insecticide maybe that they use on the plant. I wonder if maybe that's where this comes from. I don't know a whole lot about, growing weed. But however, like that would be what comes to my mind. 'Cause you can dip those cigarettes and weed, like blunts and stuff, in formaldehyde, and it just like totally blows your fucking mind.
Really?
Yeah, people that they break into funeral homes, dip their joints in formaldehyde,
Oh, wow.
and smoke it.
Huh.
Yes.
Well, it just increases the high, or what?
Is that one of your perks of being a woman?
I'll have to ask about that. No, like it makes them fucking crazy.
Oh, man.
Yeah.
So
Like
this
this
is
is
different
not,
from just being high.
this is completely different than
Oh.
being just sit back, chill, let's watch,
Rick and Morty or
Yeah.
SpongeBob.
yeah, order a fucking pizza and drink a gallon of water. This is
Yeah.
completely different.
Yeah,
Like
I've seen
they
some stuff at some parties before.
they go
Uh-huh.
crazy.
And they're like, "Hey, you want some of this?" I'm like, "No." And they just sit there smoking, next thing you know, they're on top of the bar, jumping off.
Yeah, like cray.
You know what they call
Like
the
syrup.
munchies in Spanish?
What?
They call it la bajona. And then if you get too high and you feel like you're about to die, even though you're just fine,
Right.
they call it la pálida. I mean, it's the pale. La pálida.
Well,
Sounds sophisticated.
I know.
It's very, very tedious medical terminology there.
Well,
No.
I increased my Spanish by 2 words.
There you go.
I can teach you a lot of words, just not the ones you can't say.
It's not the ones you want to say in Mexico, okay?
You know,
Cannabinoid hyperemesis syndrome is experienced, blah, 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 hot shower, blah, blah. Alright, emergency care for the patient focuses on ensuring that the adequate